Our next set of muscles are involving the lower part of the body, the lower back specifically, and we're going to start with one of the biggest movers of the lower back that people miss. It's called the quadratus lumborum. So I'm going to have Jennifer lie on her stomach to do the quadratus lumborum, and we're going to demonstrate the various techniques that you can use in the Health Source deep tissue release system. So the quadratus lumborum is located to the side and deep of the lumbar paraspinal groups. So we're not going to find it right here. So if I work on her back and just expose this skin a little bit, right at the spine and to the outside, that's where the paraspinals are going to be. To get to the quadratus lumborum from there, there's too much tissue. We can't do it. So to get to the QL, which is what the quadratus lumborum is known as, we want to move to the side of that so that you can see the big paraspinal group is here. We take our thumb and we go just to the side, but we're not pushing straight down, we're pushing down and in. And as I come into that, we start seeing her start to shift because she can feel that, right, Jennifer? Mm-hmm. And so when I find that spot, again, I move into any direct pressure situation slowly. You don't overwhelm the muscle. Just get a nice, easy start on it, find the pressure point, and in the quadratus lumborum, you can have pain go into the glutes or into the back, sometimes even into the front of the groin area. So I just start low, and you'll hold that direct pressure sequence throughout the length of the muscle. It's a very short muscle. She's got ribs that start here, and then her hip and SI joint are here, so you're only going to feel QL in a very short range right along the side there. I'll demonstrate in a little bit how to do the trap and stretch, but while she's bending or while she's lying down like this, I want to go ahead and do the adhesion tool on the quadratus lumborum. So I'll get some lotion, put it right on the skin there, take my adhesion tool, and just start working in the same area I was putting direct pressure. So I'm not over the spine. I got to get that angle, and I like to put just a little downward pressure because it's going to lift that muscle ever so slightly for me and get it easier for me to reach. So it's just a nice, short stroking motion through that area, and I can bring that right up the length of the muscle. And again, I can tell she's got some tenderness here. When I get right here, she actually feels that quite a bit, and she starts to flinch on me, which tells me that's the spot that needs to be done. So I would do this for about 30 to 45 seconds in order to release the adhesions through that part of the body. Now using the stick, and if you're going to do a combination of adhesion and stick, I always recommend doing the adhesion work first and then using the stick, because the stick is actually going to help flush things out. It's going to bring more circulation to the body versus just the breaking down of the adhesions with the tool. That's a little more aggressive. So now for the stick in the lumbar spine, take the stick and grab it at the appropriate spot. When someone is, and Jennifer, I'm going to have you just relax your hand right there. When someone is small like she is, if I have my hands way out here, I get a lot of bow, a lot of flex in this stick, and so it's harder for me to control where I need this stick to be. But I can move my hands in, and I can get a really easy control of the tool, of the device, to rub over these QL and lumbar paraspinal muscles. Now here's the trade-off. When I bring my hands in, I make this stick a lot stiffer than when I have it out. So when you bring your hands in on the stick, that means you need to guard the pressure much more. You got to be very sensitive to how much pressure you're using. So I'm going to ask the patient what the level of pressure is that she's feeling, and I want it to be a 5 on a scale of 10. So Jennifer, I want you to tell me when we get to about a 5. That's a 5. So once she tells me, I know the pressure I've got. Now it's just short, easy rolling motion over that area of the spine. Just like so. Just back and forth, and I'm going to do that for about 30 to 45 seconds to break up trigger points and increase circulation after having done the adhesion tool on the patient. Now we're going to demonstrate the trap and stretch technique that we're going to use for the lower back. It's going to include the quadratus lumborum as well as the lumbar paraspinals. And in this technique, it's really important that you remember this is an advanced technique, so you have to, as the provider, be really consistent and conscientious of your body position and of the patient position, and you really need strong hands for this one. If you don't have strong hands, this one is going to get tricky on your body and can break you down, so you have to pay attention when performing the trap and stretch on this area of the body. And the reason is the lumbar spine is so powerful. There's so much motion and force going through that region that for you to hold that force back with your hands, it just gets to be a lot of tension. So I'm going to start by just putting some lotion, just a little bit of lotion. If you put too much lotion, you're going to slide right off the thing. So we got to make sure it's just a small amount so it doesn't cause any kind of skin burn for her or irritation. Then we're going to start with the muscle in the shortened range like we do on all our trap and stretch. So I'm going to ask the patient to lean backwards. Perfect, Jennifer, just like that. Then I am going to put my thumbs, just like we did on the direct pressure. I'm going to start from outside, work inside right here, and get an anchor point. And then as she bends forward, it's going to take that muscle and lengthen it right under my thumbs. So we're going to start by having her come back here. All right, Jennifer, now slowly lean forward so your head goes like between your knees. So I've got her like this. You can see, boy, that left side's really tight. Okay, good, and come up again. We'll do that another time. And reach forward. So you'll notice that I'm really holding my body tightly and putting my thumbs together. And now she'll reach or bend forward. And that slides right under my thumbs. Can you feel that on the left side, Jennifer? Yeah, and come on up. So we would go through that somewhere between 5 and 8 times, depending on how strong your thumbs are and how tight that is for the patient. Another thing you can do here, if it's really bad on one side, you can do the same thing that we did on the neck, where she goes this way, I hold, and then she goes opposite, forward, and down. So that's the other way to do the quadratus lumborum and the lumbar spine, to isolate it on one side.